If you are suffering from hair loss, or if you know someone else who is suffering from hair loss, because we know this is very common and many of us go through it at some point of our lives, visit our page at www.folliclefusion.info for more information. We look forward to seeing you for a consultation. This is such a treat here with Smiley today. We're going to have a conversation with you all and with each other. Yes, as we are bringing awareness to alopecia. This is for Alopecia Awareness Month, and it's something that affects a lot of people. And we have an exciting collaboration now. So we're just going to talk about all things hair loss and hair restoration today.
Okay.
Mm-hmm.
Well, my name is Smiley, as she said, and this is Dr. Evans. And why don't you give us a little bit about your medical background first?
Okay, well, I've been in practice, I like to say, for over 20 years. Not over. I like to say for almost 20 years. It's over 15. And I've practiced now in Georgia since 2011. I moved here in 2011, which is around the time that I met you.
Yeah.
I'm a primary care doctor. I'm board certified in family medicine. And then I have additional training in functional medicine, which is root cause medicine. So I want to know what is the root of the issue as opposed to maybe just only prescribing medications. We like to get to the root.
That's one of the things I liked about you when I met you, was that you weren't just about prescribing pharmacy meds to me. You were like, can we work it out with a healthier way first?
Yes.
And if you don't follow through and you can't follow through, then we'll go to the medical side, you know.
Yeah, I often find that lifestyle is a good start. And don't get me wrong, if we have to prescribe, we prescribe, but we try to look at genetics, hormones, all those things first. So that is about my medical practice. I'm here in Georgia, in the metro Atlanta area, and I'm in private practice, and it's been exciting.
Yeah.
So can you tell us about your journey as a licensed cosmetologist?
Well, I graduated from beauty school in 1989 in Boston, Massachusetts. I've done hair forever. It seems like I moved from there to Providence, Rhode Island, then to Fort Lauderdale, Florida, and then to Georgia. And I've been studying hair replacement since Florida. So about 2004 is when I started. My mom started losing her hair and thinning, and I started trying to find ways to help her grow her hair. And when I couldn't make it really grow, I started finding ways to replace that hair. First, of course, with sew-ins, and then we had other little techniques, and then I started finding out about hair replacement, the real hair replacement. And I found that I went to work for one of the clubs for a hot minute to see if it was the same thing that I was thinking it was. And it was. And I said, okay, we can do this on our end for our people. Better, less expensive, and make it look and last longer and better, you know. Yeah.
That's what I found exciting because shortly after meeting you, I became a client.
Yeah.
And to me, you were about all things, hair health.
Yeah.
But then I would see by observation how much you were able to do for the clients that had alopecia and hair loss.
Yeah.
And you became my go-to for referrals. So I see a lot of people in the office that have this health concern. And I say, you have to go to Smiley's Hair Clinic because your restoration techniques were awesome and second to none. So I want to kind of shift into asking about what you see in your salon on a day-to-day basis. What are the most common types of hair loss that you see amongst your clientele?
I know it was alopecia areata and traction. Traction, of course, is because of braids being done improperly, ponytails, tight, things like that, hairstyles. That's traction. Alopecia areata was from stress, from autoimmune deficiency. Nobody really knows exactly what causes it or how to bring it back. It just can be something that ends up a small dime or quarter size, smooth surface of hair where hair was, and then for some reason it may come back, for some reason it may not, and grow bigger. And it's been associated with a lot of different things. So now it's just categorized as an autoimmune deficiency. One I've seen now I'll say it's more common now is what they're being diagnosed as cicatricial alopecia, which is like scarring, which I'm finding that they really don't know what's causing that either. But there are several components to it. And what I'm finding is that it seems like it's more internal than external, which is why, you want to see a doctor about it, but we'll get to that later. And another one that I've seen recently more so was universalis, which is, I'm surprised, that's no hair on the body at all. No eyebrows, no lashes, no hair on the lanugo hair on the face and arms. That hair is gone, and it can happen to anybody at any time. I know a couple people started when they were young, and they associated at the time with either a chemical service or some type of trauma that happened to them, and then eventually it just was gone all over, and there's nothing that they can do to bring that back. So those are like the most common ones that I see on a daily basis. And we're finding, the more we study, the more we research, the more we can find that can figure out what some of those root causes are, and what can we do internally and topically to fix them.
Yeah, and as I'm listening to you with the wide variety of the different types of hair loss, how do you help a client decide between hair restoration versus replacement?
Okay, so when a person comes in, if we can catch it early, where we just see some thinning, and again, if you see thinning in your hair, then it's already at 30%. So if we can see that early, I know you love that.
Yeah, when I first heard you say it, I was like, what?
So if we can catch it at that 30% stage, we normally can restore. Yeah. There are some cases where it's been a lot more that we can restore, that we've been able to treat once we found out what the internal cause was. But usually, if it's at like a high end and it's been there for a long period of time, the skin is hardened. You can see that its skin is hardened. It's shiny. And what the body doesn't realize it's doing is it actually is stopping the hair from growing, because hair is the protection for the skull, right? So if you lose the hair there, the skin starts to build this hardened surface because it needs to protect the skull.
Yes.
But what it doesn't know is the hairs are coming up, trying to come through that skin, and it's popping back down because that skin is already hardened. So, again, it's trying to find out how we can get to the root to soften that skin and get that hair to come back out again.
Yeah, so what I'm definitely hearing is don't delay.
Right.
If you notice, seek care right away.
Now, the problem with that is seek care from a professional.
Yeah.
Because,
part.
you don't know who's telling the truth. All right, so I have to say this little clause here. YouTube University can be great. In 2007, when the recession hit and people really needed to figure out a way to maintain their hair and all that stuff like that on a budget, $50 weave shops came out.
Yeah.
Between the $50 weave shop, having untrained stylists do braid downs, the sewing part, and then a separate person styling it. This is a la carte, we're saying. There was not a lot of room for people to care about the scalp or care about the hair, because they were trying to just get it done and get it for a cheap price. Or they were going on YouTube looking at things, trying to find out how can they save their hair, not knowing who is the professional and who is not. Like, it's hard to tell who you can trust when you're trying to figure out how to fix something on YouTube. Yes. So if they had a category where you had to show licenses and professionals and stuff like that, I would appreciate you following that person about a hair service than following a girl in her bedroom or bathroom saying this is what works on my hair, because it might not work on yours. So those things that happened in 2007 actually made the hair replacement and hair loss business more prevalent.
Yeah, so we saw the creation of a problem that has gotten us to our present day situation.
Yeah, and that's part of it. It's not the only reason, but that's most. You know what I mean?
Yeah. Because I certainly see a lot of people in the office with those concerns. They're at different stages, which is why, I refer them to you for services. But, I see that a lot. Yeah. So I'm interested. Can you share a particular client's story that comes to mind?
I do have one. This is my favorite story to tell. I'm sorry. She is a client who came to me in 2007.
Yes.
She had universalis. She was getting married in a year, and she wanted to prepare to try. Someone sent her to me to find a way to give her a hairstyle that would be up.
Yes.
Because she said she'd never worn her hair up.
Mm.
She lost her hair when she was between 10 and 12. She thinks it came from a relaxer. And then she was in class, and one day, and her and the girl bumped heads because she dropped on the floor. They bumped heads when they was doing it, and the wig fell off. And she said she was always known as the girl with the wig. She said that back then, wigs were just bangs straight down. It wasn't no way you could pull it up any kind of way. So she then also told me she never learned to swim because she had to wear a cap, and she was afraid the cap would come off. She said she'd never been on a ride at an amusement park because she thought the wig would come off. Like, this is stuff I had never thought of when I think about hair loss. And then we go to do her hair at the hotel, makeup. My sister did her makeup, I did her hair, and I gave her a style that was like flat double twist going all up with like the cluster curl on the top and whatever. And by the time I turned around, all the bridesmaids and the mama and everybody was in tears, and we all was just crying. She's like, I've never seen my hair up like this. And like, she's been with me ever since. She moved to New Jersey, was flying back to Atlanta to get her hair done. Like, it was so crazy. But I mean, and we've been friends ever since. I love her today. She's like, her story was just so impactful to me. Like, and I tell her story to everybody because I'm like, who thinks about going swimming or riding a ride? It's like, So,
I mean, great example of how changing lives.
So let me ask you, like, when you think about a client, a patient who comes in with hair loss issues, what type of tests or
workup
would you do to try to find out what the problem is?
I once had a teacher when I was in training say a lot of the answer can be in the history. So to this point of the story you just gave, I want to know when it started, what were the circumstances under which it started. Was it stress? Was it a recent illness? And so I start with the history, and then I think about different labs to order based off the client's current age and the history of when it started. So commonly we'll look at a metabolic workup. That is something I'm passionate about, and I know that metabolic health is closely related to hair loss. And so a fasting insulin is important. I want to know if there's any insulin resistance. I want to know what their current blood sugar is.
Okay.
If they are normal pre-diabetic or have diabetics, I want to know their blood pressure. There is a correlation between poor metabolic health, meaning uncontrolled blood sugar, uncontrolled blood pressure, because those things cause inflammation. So I want to see if I can pick up any of those things by lab work. Then I'm also going to look at their lifestyle factors. How is their sleep? How is their nutrition? How's their physical activity? Because those things are often related to their current level of stress.
Okay.
And then gut health. Are there any food allergy components contributing to the inflammation? So that's typically the workup that we start with in my office.
So now I know you had a little bit of hair loss story, and what was out of all of that you just said, did you do all these workups and stuff yourself? And, so tell us about it.
Yeah, and I can chuckle about it now. Back then
right.
I wasn't laughing.
You were stressed.
I was, and that was the problem. I was stressed. Yeah. And I completely threw off my metabolic health. I was going through a stressful time. And so I suspect my cortisol was up, my insulin resistance was up, and I had evidence of that by blood work, as well as my blood pressure. I had poor sleep, so I had all the things that can contribute to insulin resistance worsening. And then, so I did the workup, I evaluate my lifestyle, and then I also talk to you, because it's not good practice for me to be my own doctor, but I had to start where I could, because sometimes we have to make an appointment. It takes a while.
Right.
So I started where I could. And then I was like, duh, I know Smiley. So I reached out to you, and you helped me treat it from the outside in.
Right.
I don't know if you want to get into that now, but you helped me from the outside in.
Right.
And then I was working on from the inside out. Yeah. And
the results, I wish I could show before and after. We should have did that.
I know, yeah.
But, I mean, look at her beautiful hair.
Yeah, it's relaxed. I mean, I was literally losing locks.
Yeah.
Handful, yeah.
She had a spot like this that was almost smooth to the skin, and it grew all the way back.
And I'm glad that I did not delay any longer, because by the time I noticed, because of where it was, I'm sure I was even more than 30% density loss. Yeah. And so that's something that I really, really hold on to. You don't want to delay. You have to be pretty I don't want to say quick, but intentional about
Yeah.
your intervention.
Yeah. I know a lot of people when they first start to notice it, they try all these remedies that they find online,
Yeah.
like all these oils and all these things like that. And sometimes some of those things may work, but it's how it's being used,
Yes.
and that's what makes the difference. So it's not just about putting some oils on your hair and combing it and that's it. But I mean, you have to go to seek a professional that knows about hair loss, a reputable professional that knows about hair loss before you start trying to remedy it yourself.
Yeah, I do want to say a lot of times those remedies can be like a band-aid, but not addressing the root of it.
Exactly.
And that's what I find a lot of people like. Anyway, I just wanted to offer that framework too. Like, you may notice results, but if you stop use,
right,
it can reoccur.
Exactly. So we started a program together.
Yeah.
All of this led to us starting a program together for hair growth. The basis is to catch it early and try to grow that hair back and stop any more hair from falling out. And I'll say this, with people that are supposed to be genetic, we might not be able to stop it, but we can prolong it so you don't lose it right away, Yeah.
And to that point about genetics, a lot of, we especially believe in functional medicine that genetics account for 30% of disease manifestation. So lifestyle plays a big role. So genetics we don't deny, we don't ignore, but we try to turn those genes off by healthy lifestyle choices to decrease the impact of the genetic predisposition on the disease, including hair loss. So that is part of our workup with our collaboration.
Right.
Yes.
Right.
The history is important, the family history is important, and your current situation is important.
So the program is called Follicle Fusion, where science meets beauty.
Yes.
Science meets beauty. Starting Alopecia Awareness Month, which is September 1st, join us for our podcast, Chopping It Up with Smiley, or for the docu-series, Crown and Glory, The Journey Back to My Hair, and also for Testimony Tuesdays. Hope to see you there.
We mentioned it earlier, when you helped me with my hair regrowth journey, I used your system. So I want to hear more about the
topical products.
Yes,
okay.
Yes.
So we have a prescription strength hair growth system called Cilium Surge. The shampoo is called Invigorator Anti-DHT Shampoo. The conditioner is a Stimulating Dew Anti-DHT Conditioner. And then we have a treatment spray that you use daily, which is called Cilium, and that's a follicle stimulator. These three products together all block DHT. They stimulate the nerves, bring blood flow to the scalp, so that as the strand of hair grows out, it swells at the base and anchors to the scalp so it doesn't fall out. So this product line is the spray. I mean, the shampoo conditioner can be used like once a week or once every 2 weeks, however often you normally would shampoo. But the spray is very active, and you need to use that every morning, once a morning. Spray just a little drop, massage it into the scalp in the area, and then just watch it grow. We take pictures every 30 days to see any change, and that's the topical way that we treat it. As well as when you come into the salon, we have an actual stimulator that has an infrared light that massages on the scalp, and you put it in that area for so many minutes, and that helps stimulate the nerves along with the treatment system. So that's all part of the 10-month program as the part that I do. Now, as far as the part that Dr. Evans does is the wellness side, which would be.
And I do want to say about your product line, it's exciting because you get immediate feedback. You can feel the stimulation on the scalp. And then when you were talking about this, the stimulator you use on site, I was imagining that toughened scalp skin that you were mentioning earlier, kind of softening and letting the hair come through.
Absolutely. That's one of the things I love about it.
Yeah, so that's one of the ways that we work together. You're decreasing the inflammation from the outside in, and I'm doing it from the inside out. You mentioned DHT, and that is something that we look at during the functional medicine evaluation because we're looking to see if there's a hormonal component to the hair loss and the hair thinning.
Yeah, so people want to know, like, sometimes what is DHT dehydrotestosterone. And what it is it's something that attaches itself to the follicle, the base of the follicle, which makes the strand of hair weaker, and it tends to make it either fall out, shrink, or not grow back.
Yes. Yes. And so we're working together. We're working to address hormonal imbalances as well as that increase in inflammation. Something that we have as part of our wellness services here in the office are our wellness shots. And so, as part of the 10-month program, you will have integral wellness shots. Our popular ones are vitamin D. We know that most people are deficient in vitamin D, especially people of color. The melanin in our skin blocks us from making it from the sunlight. And so we do vitamin D injections, which are important for all things health and wellness, but especially hair regrowth. Also, one of our other wellness shots is the Tri-Immune shot, and it's one of my favorites. I get it every week, and it has vitamin C, zinc, which are both important for healthy skin and nails and hair, as well as glutathione. And we commonly call glutathione the master antioxidant. If we think about metal being exposed to weather conditions and having rusted conditions, an antioxidant is helping our body get rid of the rust. So it's helping our bodies decrease inflammation. Around the world, glutathione is called the beauty hormone. People have a glutathione glow, but that is part of the wellness shots or the wellness services you'd be getting in the office, as well as addressing whatever can be going on as a root cause from the extensive lab workup.
And don't forget the zinc.
Yes. And then,
supernatural.
yes, this is exciting. So another way that we help support natural intake of zinc is through the Supernatural's daily routine. So it's a daily supplement that has an active ingredient. It has 7 active ingredients, but they're all natural from the earth. But one of the main ones is guava leaf. And when I first learned about guava leaf, I was so excited because it's a natural source of zinc. I call it the product like nature's multivitamin, but that guava leaf helps restore hormonal balance. It helps improve metabolic health. The testimonies are awesome, and I'm excited about it. So it is one of the key components of the program.
Yeah, so I'm so excited about this 10-month program. The kickoff is for the 1st of September, which is Alopecia Awareness Month. The website for that is www.folliclefusion.info.
Please check us out there to get more information. We look forward to seeing you for a consultation. You can sign up on the website, and we will see you in person. Yes.
Okay.
Yes.
Are we ending like this?
I don't know. All right, so September is Alopecia Awareness Month.
Yes.
What do you have planned?
So we have a podcast called Chopping It Up with Smiley's. We also have a docuseries called Crown and Glory, The Journey Back to My Hair, which is 4 women telling their story and allowing us into their private home. And then we also have Testimony Tuesdays. So see you there.
Yes. If you are suffering from hair loss, or if you know someone else who is suffering from hair loss, because we know this is very common and many of us go through it at some point of our lives, visit our page at www.folliclefusion.info for more information. We look forward to seeing you for a consultation.